Hello everyone, I am Shiwali Sharma, MSc Community Health Nursing. Today I am going to discuss about occupational health. Before starting occupational health, we have to know about what is occupation. So occupation is an activity or an work in which an individual engaged to earn money. Now we will discuss about occupational health. Occupational health refers to the potential risk to health and safety for those who work outside the home for earning money. After occupational health, what is hazards? Something that can cause harm if not controlled, it will cause hazard. Then next is occupational disease. Occupational disease described as which is directly caused by a person's occupation, where a person is engaged to earn money, which directly or indirectly causes his health harm. Then, definition of occupational health. Occupational health is the promotion and maintenance of the highest degree of physical, mental, and social well being of all the workers in all the occupations. Next is the aim of the occupational health. The main aim or the main focus of the occupational health is the promotion and maintenance of the highest degree of the physical, mental, and social well-being of all the workers engaged in particular occupation. Then next we have functions of occupational health services. First is pre-employment medical examination. When the person is appointed to a particular job, then there is a placement or pre-employment medical examination, in which head-to-toe examination of the patient is done by a medical officer or the occupational health nurse. Then first aid and emergency services, supervision of work environment for the control of dangerous substances in the work of environment. Then special periodic examination, medical examination, particularly for the workers in dangerous operations.